My name is Henry Shenkman, and I'm 75 years old today, and I'm having a good time. I'm a producer of nature video, and I'm also a survivor, a person who's had to cope with 17 years of myeloproliferative disorder disruption to my life. I'm doing this video as a gift to you to try and give you some of the things that I didn't have and learned along the way, so that as you're working on your disease or taking care of the person who has the disease, or if you're a doctor and you want to inform people about what the life is, then that's my gift to you. What is this myeloproliferative disorder that I have? And you probably have also. Myelo means in the bone marrow. Proliferative means too much. Too much of what? Well, too many cells, too much activity, too much, just plain too much. Bone marrow stem cells make blood, the parts of the blood. The most important ones that we're concerned with here are red blood cells, platelets, and white blood cells. The myloid stem cell has many controls and information that comes to it. The controllers for making blood come from chromosome 5. The 5q is what that's called, and that tells you slow things down. The blood stem cell sends a direct message to the myeloid stem cell saying it's time to create blood. And so what this diagram shows is that everything is working normally. The JAK2 is in the green zone, and the 5q is in the purple zone. It's telling the bone myeloid stem cells to go ahead and make red cells, platelets, and white cells. Okay, as you can see from the diagram, the red cells, platelets, and white cells all are in the just right level. Dr. Gordon called me into his office in 1995 and said, "Hey Henry, your blood is weird, and I need to send you to a hematologist. I suspect that you have a disease, and it's one that you cannot ignore." So then I made an appointment, and I went to the hematologist, and when I got there, they did a complete series of examinations to rule out or rule in the diseases that Dr. Gordon was concerned about. They ran a series of tests. They were a general physical, a palpation of the spleen and liver. A lot of blood was taken. A bone marrow aspiration was done to get bone and the bone marrow cells for evaluation and an MRI. What they found was that the control agent on chromosome 5 had disappeared. So at this point, there was no way to put the brakes on the JAK2. The JAK2 signaling is in the red. There's nothing to slow it down, so it says full bore. Let's make red cells, platelets, and white cells. Blood work was done. They found out that I had too many cells, and this was creating a lot of problems. Myeloid stem cells at this point were working overtime. The diseases were called polycythemia vera, which means too many red blood cells, and platelet count of too high, resulting in the diagnosis of thrombothcymeia. So the hematologist said, "It's time to begin your treatment, and we'll begin it immediately. What we will do is phlebotomize your blood." That means take a lot of blood from you, and then we will also give you something to slow down the myeloid stem cells, namely kill them off through chemotherapy. So what you see is by the vacuum cleaner, they sucked 17 pints of blood in 17 weeks. That's 4 months and 1 week of phlebotomy. And that was the last of the phlebotomy. So the chemotherapy kills off myeloid stem cells, and they continued this for 4 years until my blood level came into a higher than normal range. There was no treatment, just a look and see and check in for a blood draw every 2 or 3 months to see that the numbers were correct, until I was going to have knee surgery in 2003, and they were afraid that I might clot during the surgery, so they gave me the chemotherapy again. Then no more, with the exception of the 1 month period for the surgery. I was not taking any medication. During that period of time, I had plenty of energy, behaved as if I was normal, didn't know anything was going on. However, the myeloid stem cells were beginning to burn out. When myeloid stem cells cannot produce the blood you need, they send out a signal through the system called cytokines. Now these send a signal to the liver and spleen saying, help me out and make some blood. And they also send out a signal to the rest of the circulatory system saying, we're in trouble, so what we want you to do is give us a help by being aware of our situation, and this causes inflammation. In 2009, I was out in the field with my buddy Bill Howell doing a nature shoot when all of a sudden I felt like I was going to pass out. I had sweats, I was chilled, I was disoriented, and I went into the car and sat down, and it took 45 minutes to feel normal. This is what I called the first sudden fatigue event. And this sudden fatigue event led me to go back to Dr. Gordon and say, what's going on? Well, he said, let's keep an eye on you and increase the amount of blood draws we have. We'll do it every week and see what happens. And after a month and a half, he said, there's enough information here for me to send you back to the hematologist. The hematologist gave me the same routine of investigation, the blood draw, the bone marrow, and the MRI examinations. And at this time, I was really, really in bad shape. I couldn't walk very far. I was disoriented. I had no energy. I had night sweats, pain in my bones. So I felt like a zombie. The result was I received a diagnosis of myelofibrosis. So what that means is the myeloid area, or the bone marrow, has fibers in it, and these fibers are from the wear and tear from all the overload. I was really sick. This was in 2010. As a result, we had another meeting, and my hematologist said, well, I know you're not doing too well, but there's not much I can do because of the way the insurance company tells you to treat this disease. They want you down about 8 on the hemoglobin count, and they want to delay putting you on transfusions for a while so that you don't get iron overload. So right now I'm going to do nothing. And I said, hey, I feel awful. I'm a zombie. I can't do anything. I have no quality of life. He said, well, if you want to do something about it, there is some new experimentation that's going on, and they have some experiments on JAK2 inhibiting drugs. You can find them on the internet. Went on the internet and I discovered that right near where I live at the Moores Cancer Center in the University of California, San Diego, they were doing a drug trial on the Insight drug for JAK2 inhibiting, and it's a treatment for myelofibrosis. So I made a call at the drug trials. I met Tristan Lutz, who administered the drug trials for Dr. Catriona Jameson at the university, and he did an evaluation, had me fill out some paperwork, and said, we will meet with Dr. Catriona Jameson for an evaluation and see whether you will fit into our study. They put me through the same routine, blood draw, physical examination, bone marrow, and MRI. And I received notification to go into the JAK2 inhibitor trial with the Insight drug. When they first gave me the drug, I overreacted. They gave me the standard dose of 8 pills a day. That was just too much because what the JAK2 did was turn off, so I was making absolutely no cells at all. I had blood blooms on my arms, but I felt wonderful. The cytokines were gone. So I had none of the symptoms. So with no symptoms, I felt energetic. However, they told me that we're not going to leave you at that level because it's very, very dangerous to you. So Deborah, the nurse, instructs me on how to take care of myself because of the danger of bleeding and getting infected. At this point, they cut the dosage of the drug and started me off on transfusions. Transfusion is the primary treatment that they've had for years for myelofibrosis and other types of anemia, including the cancers. One of the things that I noticed with the hemoglobin is that I know when I'm due for a transfusion pretty much by my libido. When I get a transfusion and I'm up about 12 hemoglobin, then I have an orgasm time. I'm able to have an orgasm, give one to my wife, and enjoy sex again. As it decreases, I go into a stage at about 10, 10 and a half, where I can still perform, but I can't finish. Then under 10 and a half, I just think about it. When I get under 10, the chapter on sex is gone from my life. Transfusions are not without their problems, and one of the problems is that you cannot get rid of iron in your system as quickly as the iron is put into your system by the transfusion. So then you wind up with complications from the iron, and after 20 units or 10 transfusions, it's time to give you another drug called Exjade, which chelates the iron, that is, extracts the iron from your blood cells and lets you excrete it. So that's where I am today. My treatment at this point is I'm receiving periodic transfusions as my hemoglobin level gets below 10, and I'm taking the JAK2 inhibitor drug, and I'm also now taking a drug called Exjade to chelate the iron from my system. I want to show you the effect of transfusions on me by two video takes that were taken by my son-in-law, one 4 days before the transfusion and one 4 days after the transfusion. Hi there, I'm a grandpa, and I still ask the questions I did when I was your age. How come? What? Where? Who did? Why? How do you know? Because I ask questions, I've come up with some ideas that I want to share with you about ecology. I'm a grandpa, and I still keep asking questions that I always asked, the same that you're probably asking at your age. How come? What is? Why not? Where? When? How do you know? Everything you touch, feel, smell, hear, taste is a subject for the study of ecological science. My 17 years started out with 4 years being a blood bomb, worried about blowing up, having either an embolism, a heart attack, a stroke. Then I had 8 years where everything was almost normal. Then 2 years where we went through a burnout period and then became a zombie for 8 months. And now, for the rest of my life, up here, I will be a vampire. So that is the story of the disease process for Henry Shenkman with myeloproliferative disorders, also known as MPN.